Assalamualaikum. Welcome to Minute Meds. And we are going to study malaria. So, malaria is an infection that is caused by the organism, the protozoans, Plasmodium. There are five types, naming Vivax, ovale, Malaria, falciparum, and the new one Nolisci or Nolisci. Now, the pattern of the fever is almost same as dengue fever, almost same. The patient usually presents with high grade fever that is accompanied by rigors, chills, headache, body aches, nausea, vomiting, all the constitution symptoms. Now here, the pattern of the fever, this gives a clue about the type of the strain that is infecting. So in the cases, if the fever comes on every other day, on every alternate day, it's called tertian fever. And the strains are usually the Vivax and ovale. These usually have this pattern every other day, every second day the patient has fever. If the fever occurs on every third day, then this is called quartan fever. It is caused by the strain Malaria. And the falciparum, the most notorious, this is the type of the strain that has no specific pattern. This is the reason, because it involves the RBCs of all ages, from erythroblast to the normoblast. All of the stages of the RBCs, these are involved by this strain. While the Vivax and the ovale, they usually involve the reticulocytes. The Malaria, these usually involve the normoblasts, the adult RBCs, and the falciparum, all of the ones. So this is how a patient presents, and how we investigate such a patient. I have gone directly to the investigation because the patient, like malaria, these don't have any source of infection. So there is no other clinical finding. There is no congestion of the throat on clinical examination. The chest is clear. There is no hypogastric tenderness for the cases as we look for the infections that present in the form of urinary tract infection. Sometimes the patient has splenomegaly in the cases of malaria. Otherwise, as the patient presents, examination is unremarkable. So how we investigate this patient? We start with complete blood count, and it shows normocytic anemia with thrombocytopenia. So why this occurs? Because of the splenomegaly. In case if it is present, then that will lead to hemolysis and as well as thrombocytopenia. Now, what are the specific investigations to confirm malaria? The most commonly used is the slide method, that we use thick and the thin slides. We use the thick slide to check the presence of any parasite. Means for the diagnosis, the malaria is the patient has malaria or not. If it's gone through this, then we move on to the next step. We use a thin slide, and this is to specify the strain, to find the species Vivax, Malaria, or aware of the falciparum, because it changes the therapy. This is the usually method. This is the usually investigation that is being that is done for the malaria. Now, what else? What are the other investigations that can be done that are in different setups? Another one is the immunochromatography for the malarial parasite. That is done in our setups. And then the other investigations, just for the sake of knowledge, that the malarial antigens can be looked for, and there are different tests with the name of like optimal or parasite F. This parasite F is specific for the malarial antigen of falciparum malaria. Then we have also the modality of fluorescence microscopy, and this test is named as QVC malaria test. The QVC malaria stands for quantitative puffy coat. You don't need to have go into the detail, but this is usually what is being done for the investigation of malaria. But as far as the most common modalities that are used, we start with the CBC, we go for the thick and the thin slides, or we go for the ICTMP, the immunochromatography. These are the other, just for the sake of knowledge, you should know that. Now, we come to the diagnosis of malaria, and we come to the knowledge of having the strain which is causing the malaria. How would we treat such a patient? First, the general treatment is to give antipyretics like paracetamol, antiemetics, no specific diet restriction, or dietary advice. Then, according to the strain, the antimalarial changes a bit. For non-falciparum strains, means ovale, Vivax and Malaria, the drug of choice is chloroquine. I'm not going into a dose. We give about 1000 milligrams in a standard dose, then with different regimes. And for the falciparum type, we go for the combination of artemether and lumefantrine. So the general treatment is the same, and then according to the strain we do this. Now, in the pathophysiology of the malaria, there are some strains that have their remnants in the liver, and they stay there, and the patient has recurrent attacks of malaria. These strains are Vivax and ovale. These remain in the liver as haplozoids, and the patient has recurrent bouts of malaria. So in such cases, we treat the acute attack with the chloroquine, and then after completing this course of antimalarials, we prescribe the patient primaquine, 15 milligram per kg for 2 weeks. This is usually the treatment. Now, some exceptions, which is, what if a patient is pregnant? Are antimalarials contraindicated in pregnancy? Yes, these use the chloroquine and the artemether, these are contraindicated in the first trimester. In the first trimester, we prefer quinine. And then in the second and the third trimester, we can go for the artemether and the lumefantrine. So in the first trimester, these two, the usual antimalarials, these are contraindicated. We go for quinine. And then in the second and third, we can use the lumefantrine. So this is the treatment of malaria, but this is the patient who is able to take in, who is not toxic and who hasn't developed complications. So a few words about what are the complications and how we treat the complications of malaria or a complicated malaria. So complications in the central nervous system, the patient can come with coma or convulsions or the cranial palsies. In the cases of cardiovascular system, the patient can come with heart failure, acute pulmonary edema. Then in the respiratory system, the patient can have aspiration pneumonia. Then endocrinological, the patient can have hypoglycemia. Then the patient can get into sepsis or septic shock. Now one by one, we will do the treatment of this. Now for all the complications, the oral antimalarials are not given. The first thing is we admit all the patients with the complications. We give IV antimalarials, the IV artesunate compound. So the basic is we admit, we give artesunate, we IV hydrate the patient, and then the complications one by one. Like in the cases of coma, what we do is we intubate the patient, we give ventilatory support, and then the same treatment, the IV antimalarials. If the patient has convulsions, then the same, we admit the patient, we give the IV antimalarials, and for convulsions, we give intravenous benzodiazepines like diazepam. Now, in the CVS, the heart failure, which is called the cardiogenic shock, which is also called as algid malaria. Malaria complicated by cardiogenic shock. In this, what we usually do for the pulmonary edema, we prop up the patient, we dilatate the patient, and we give oxygen. The same symptomatic treatments, the supportive treatments. In the cases of aspiration pneumonia, apart from giving the antimalarials, IV hydration, we send the blood cultures, the sputum culture, and we give antibiotics for anaerobic cover. Aspiration usually anaerobes, which are usually the commensals of our oral cavity. If the patient is having hypoglycemic shock, then as we usually treat the hypoglycemia, we give intravenous hypertonic solutions, 25% exposed water or 50%, whichever is available, and then we give 5% exposed water for 24 hours. Observe the patient and we treat the patient by giving the IV artesunate compounds and the hydration. And then last is sepsis. If the patient malaria come to you with sepsis, then the protocol of the sepsis is observed. It is performed. We send all the cultures the blood culture, the urine culture, and patient is put on broad spectrum antibiotics. Until the culture report comes back and we just change the therapy, tailor the therapy according to a culture report. And besides this, the IV anti-malaria therapy is going on. So this is all about. In the bottom line regarding the treating the malaria with complications is, in all the complications we admit the patient, we give IV hydration, we give IV anti-malarials, and then according to the complication we treat the complication as it is. So this is all about the treatment of malaria. Thank you very much.